Good morning. The experience that I'm going to share is quite different than the ones that we've heard to date, but I think there are lessons to learn from all of these that we can think about how to combine the role of agriculture and nutrition and to make these sustainable for the well-being of vulnerable populations. I would like to start by recognizing the fact that the group with whom I worked is a very large multidisciplinary team who helped to develop the ideas, to put into practice the interventions, and worked very hard to document the project and its effectiveness on the outcome of interest for us, which was child nutrition. The planning and execution of the intervention was in collaboration with health and agriculture partners in universities, including Iowa State University in the United States, University of Ghana, and McGill University in Canada. The governmental organizations, including the Ministry of Food and Agriculture and Ghana Health Services, and the non-governmental agencies, and in particular, Heifer International from Ghana and Freedom from Hunger in Ghana. As well as the private industry, we worked very closely with rural banks and, of course, with communities. The integration of nutrition, agriculture, and social science researchers, as well as working with the researchers and the non-academic program staff, is not an easy thing to do because disciplines and institutions have very different ways about how they recognize problems and how they think about how to address those problems. However, we found that taking the time to learn and to work with each other resulted in a very richness of approaches and activities that helped identify the multiple barriers that exist to achieving outcomes and helped to identify multiple approaches that we could use. And we all know that there's never just one barrier and there's never one solution to achieving optimal health. So my first take-home message from our ENAM project is that nutrition problems are very complex and that programs need to address that complexity by bringing together different disciplines and different sectors. The ENAM project rose out of a response to very clear evidence from the nutrition researchers over the years, some of whom are at this meeting, who identified that there were clear benefits to having animal source foods in young children's diets. Previous projects that had been funded through the Global Livestock CRISP program of USAID, over 20 years really of research, demonstrated that through randomized controlled trials that adding meat or milk to school children's diets significantly increased cognitive scores, growth, physical activity and behavior, and decreased risks of morbidity. So there's very clear evidence that we can improve children's outcomes with improving their quality of their diet. And the question that remained out of the analysis of these research projects over the years was, what are the true barriers to improving children's diets? In this particular study, we were interested in looking at what are the barriers to integrating animal source foods into young children's diets. Certainly at the time when we started this project, there was a common belief that the major problem was inadequate income, and that was an insurmountable barrier, and I would like to suggest that that's not the case. Ghana was a reasonable site to address this question, whereas there had been some improvements and a lot of interest in child health through the Ghana Health Services. They had managed to increase exclusive breastfeeding rates quite dramatically, and about the best in the world, actually. The quality of the diet of young children, once they introduced foods, remained very poor. This contributed to extremely high prevalence of anemia, with 78% of children from 6 to 59 months in 2008 having been anemic, and over a third of the children being stunted. And malnutrition, as we heard earlier, is an important contributing factor to the under 5 mortality rate, which in Ghana at the time was 80 over 1,000. So the Anon Project started by developing a problem model that would guide all of our activities over the years of the project. This was carried out in full collaboration with all of our partners that you saw on that first slide, as well as other non-governmental organizations and trade agents, organizations that we brought in to talk to us and to share their ideas. Over a lengthy workshop, we developed a problem model shown here with the highlighted areas, those key areas that our partners felt any project should address if they were going to deal with the issue of availability, accessibility, and use for young children of animal source foods. You'll note that income is certainly there, but it's not the only one. They talked about having to address problems of marketing linkages, processing and storing foods, of improving the nutrition knowledge of families as well as individuals who are working with those families, household food allocation practices, as well as cultural beliefs that might limit foods and because they were thought inappropriate for young children. In addition to formalizing this model that would serve our project, one of the fundamental parts of bringing our partners together in this very early stage was that they became committed to the project and felt ownership of this project over the years and helped to lead to a sustainable activity. So my second message is bringing your local partners from very different sectors at the beginning and assure that they're very active partners rather than just partners in name. The Anon Project was a quasi-experimental, community-based intervention that was focused on increasing the use of animal source foods in children's diets in rural Ghana. It was carried out in 6 rural communities. We had 181 caregivers of young children who lived across 3 agroecological zones. We had 6 matched communities with 287 women and their children who were selected as the comparison group. And the intervention was a 16-month project that consisted of 4 sequential 16-week microcredit loans to support individual women's income generation activities and included weekly group meetings in the communities for entrepreneurial training, young child nutrition education, and then the weekly collection of loan repayment and individual savings, which was targeted at 10% of the loan. The loans were small, about $50 per caregiver, which increased over time. And all the participants formed into solidarity groups of 3 to 5 women who were responsible for approving each other's loans as well as guaranteeing the loans. So the renewal of loans at each cycle depended upon repayment of all loans in the village. The type of activities that these women did included fishmongering, fish smoking, selling of different kinds of foodstuffs or cooked foods, processing foods for resale, and egg production. We found that the project needed to offer not only money, but also, in cases, technical support and some in-kind grants for specific activities to allow women to engage in them. So, for example, Heifer provided support for women who wanted to raise poultry for eggs. Money was not always sufficient. Sometimes families were unable to access the consumables that they needed to start an activity, and so the project needed to take those into consideration and to provide those directly. And those were lessons that we learned from listening to individuals with a lot of experience in doing income generation activities around Ghana. Our mutual relationships were very important. With the Ministry of Food and Agriculture, they seconded 2 of their staff to our project, which resulted in benefits for both of us, that their staff were able to better do their activities, and we gained very experienced field staff. The project collected data quarterly for the intervention and comparison households in microcredit performance, household socioeconomic indicators, food expenditures, food security, nutrition knowledge, and children's dietary intakes and anthropometric measurements. And we used qualitative methods of case studies to understand the variation success of partners. The integrated intervention demonstrated that poor households could improve the quality of their children's diets by increasing the profitability of their small businesses. Rural women increased their purchasing power. They were able to decrease household food security and improve the quality of their children's diets and nutritional status. My third take-home message, and perhaps the most important one, is not to forget to bring in your partners who are going to help with the sustainability and bring them in very, very early. In our last 2 years, we worked very closely with Freedom from Hunger on the transfer of the project to a permanent local institution, the rural banks. In our region, none of the banks were working with microcredit due to poor experiences in the past, and the project was able to reduce the risk for those banks in starting up their programs. We provided the training, the equipment that they required, and most importantly, we provided 184 women as their first clients who had proved themselves creditworthy for 16 months. The local rural banks provided resources to continue not only the microcredit, but also the nutrition and the entrepreneurial education as an integral part of their loan program. This may not have happened if we had not had the time to reinforce the importance of education to the banks. So now in the north and the central Ghana, the banks have hired our staff to continue as project staff to carry out the education components. And they have rapidly expanded beyond our areas. After 1.5 years, they were assisting over 2,000 women, 96 credit groups, had 12 dedicated staff, and were rotating over $1 million. So in conclusion, the Anand project provided evidence that an integrated package that is based on sound scientific research, so that you know that what you do should have the effect that it will have, offers both knowledge that offers both knowledge as well as a means for the women to act upon that knowledge, can improve household food security and the diet and growth of young children, and that this is a viable approach that can be used by private financial sectors to reach out to isolated poor households and improve child nutrition throughout Ghana. Thank you.